I'm Dr. Taberzi. I'm one of the third-year residents here at Beacon Health System Memorial Hospital, and today we are going to do a tour of the OB floor. It's one of the garages that we typically park at whenever you work an OB shift. There's specific physician and delivering physician parking that we can park at right outside the doors for the shift, so if you need to run in, if you have a clinic patient who's pregnant that you need to run in and deliver really fast, it's right out there. And then as you walk in here, you come up to the front desk where the patients will sign in if they need to come into triage to be evaluated, if they need to come back for a C-section, they're here for a scheduled induction. This is where we typically start and meet. So we will walk around here into the rest of the OB floor. We work with 3 different OB provider groups in town. 2 are OB and 1 are midwife, and because we're the only residents here, we really get to see a little bit of everything, which is a great experience. Back here we have the front entrance where all the patients will come in, and then we have the doctor and faculty and all the other staff that can come in through this door. So we'll go back here. So right here we have the hospitalist on-call room. This is where OB hospitalist who works in-house who will help us with literally anything at any time of day will be in there. We have the staff lounge here. The nurses have their locker rooms. And then as we continue down this hallway, if you go all the way down, we have our OR for C-sections, any kind of procedure we may need to do at any time. And typically, if the OB fellow's not around, we first assist on all those procedures. And then we have the physician's lounge here, which is where we have a coffee machine, we have our scrub machine, there's snacks in here if you need to get something in the middle of the night, and then respectively we have female and male locker rooms for us to change in. Down this way we have our sleep hallway typically, where we have the call rooms. Through the work of our attendings and the chief residents, we have our own call room number 4. That is specifically for us when we're on OB. We have a bed, there's a TV, there's a bathroom, and typically if you get a chance to lay down, you can just kind of rest in here and get other work done if you need to. I will turn the light on. It looks like somebody is in here right now, but the lights take a little while to come on, but they're very, very nice. They're spacious. They're perfect for when you have like an hour or 2 and you just need to lay down and rest. So we will go on to the OB floor itself right now. So as you walk in here, we have Dr. Chandler, who is having her first day of OB today, and then you kind of walk into triage here. So this is effectively ER for all of our OB patients. We have 5 rooms here, and they are fully equipped and stocked to handle pretty much anything that we may need to see, you know, from bleeding, florid labor, any kind of pain. We see a little bit of everything. We'll go in this room here and just take a peek at what we have. So each room has NST monitors. We have a bed that are really, really cool. They convert, so if we need to do a speculum exam or we need to check cervixes, we have all of that here. We have everything from swabs, microscope slides in each of the rooms, and they're really fully equipped to handle whatever we need. We also have our portable ultrasound that we're using literally all the time up here, so we get great experience with that. Our light, and in this area right here is where we typically hang out when we're on our shifts. We walk into the main area here. We have our board that looks at all of the C-sections and inductions for the day, and then we have the tracking board, so to speak, where you can watch all the NSTs from out here. The nurses hang out here. They're always such a huge help, and a lot of times you can find the attendings in here at any time. So if somebody comes to triage and you're not really sure what to do, they're typically in here. You can just run a quick question by them. We also have a microscope. We do lots of wet mounts. We check for ferning. We do a little bit of everything up here. So it's nice to have that we have all of these resources at our disposal to do such a thing. We will come out here into the CB, or the childbirth unit itself, on the floor. So we have 10 birthing suites. Each one is very well equipped to handle laboring moms, whether it's they're coming in and precipitously delivering, or they're being transferred down from SCO for a delivery. So we will go into birthing suite 4 really quickly here. So each room has the bed that is capable of being broken down when the moms are ready for labor. Very spacious for family members. We have anything from IUPCs, fetal scalp electrodes, if we need to do a Foley catheter because moms really aren't progressing, we can do those as well. And the nice thing about us being the only residents here is we get to do all of those procedures firsthand. And it's not like you're just thrown into it. All of the OB attendings, all of our family medicine attendings are always helpful to come over and kind of guide us through the procedures with whatever we're comfortable with. We also have a couple tubs that some of the moms will deliver in, particularly with the midwives. We're lucky we have one of the rooms here. And a lot of the midwives are very open to letting us doing really whatever we'd like to do if we'd like to be involved with that. So really a fantastic experience. And then for the last bit here, we will come back down and I'll just show you guys down the hall. So in addition to having the laboring moms, we have a special care obstetric unit down the hall at the other end. So this is anywhere from any kind of antepartum fetal monitoring, from PPROM, all those moms who are high risk and need like MFM to come and see them while they're in the hospital. We work very closely with them and they're down there, and we start inductions and move them down here. And then finally we have the other entrance to the OR for C-sections and everything here. Thank you so much for coming along for our tour today, and we look forward to seeing you guys.
Hey guys, my name's Natalie Burkhart. I'm one of the second-year residents here at Memorial Hospital, and today I'm going to show you some of the floors that we work on a lot when we are on our inpatient medicine rotation. So right now we're on 3HV. This is kind of a step-down unit from our ICU. It's heart and vascular, so we do a lot of heart attacks, AFib, things like that, drips on this floor. And this is one of the rooms. So it's pretty common that we admit patients to this unit. The nurses are really fantastic and do a lot of drips on this floor. So this is an area that is always available to us to get food and snacks on a busy day. It's especially useful at night when the cafeteria is closed. So the program provides some cards for us where we can come get free snacks. This is our ICU. So we have an open ICU here at Memorial. We have 26 beds, several intensivists that work here and that are present 24/7. But it's super common for us to admit patients regularly to the ICU with the help of our attendings and then the intensivist as well. So this is 3 South. This is one of our general kind of med-surg floors. We have several med-surg floors and telemetry floors on the hospital that go all the way up to 12. So this is just an example of one. We do have negative pressure rooms. One's right here, and then they're kind of all spread out throughout the hospital. So the hospital typically remains pretty busy, and so we don't have any open rooms to show you on this floor, but pretty similar, just don't have the telemetry capacity on this floor. Coming up here on the right is the nurses station. So this is a nice work area. And then back around behind, there is a spot for physicians to be able to document and dictate. And so this is one of my favorite places to come hide and chart. But we do have like special dictation rooms or areas on all the floors, which is nice. So if you're somebody that wants to get your notes done while you're rounding, it's really easy to do that. So we are down in the emergency room where most of our admissions come when we're on medicine. We also do a couple months of ER through the residency program, and this is what we call the fishbowl. It's kind of just a central area where the docs and nurses hang out. And then this is one of the physician workstations, which is nice to spend some time in there when you're like looking at people and things. And then this wall is our trauma bays. Back here is one that is empty that I can show you. So we do get a fair amount of trauma that comes in. And so this is one of trauma bays. So set up really well for procedures, intubations, and all sorts of things. Emergency room is 40 rooms, so it's kind of like a big rectangle, and then we have another little kind of unit back in the corner. So that concludes our medicine tour. Best of luck to you guys throughout the rest of your interview season, and hope to see you in person someday.
Hi everyone, my name is Chinyama and I'm one of the second year residents here at Memorial, and I will be giving you the PEDS tour. So this is where you would typically come in. So we'll just start off over here. Once you come in, there will be rooms to your right, and to your left will be the first nurse's station. And I'm just going to show you what a typical room looks like here. I think the PEDS floor is the best looking floor on the entire hospital. It just recently got renovated. They are known as Beacon's Children's Hospital, and we do get referrals from quite a few places in Indiana, mostly all of northern Indiana. And we have nice couches for the family, and we have a bathroom for the family as well and the patient. And the PICU side will look very similar. The only difference is they have capabilities to run a lot of like machines and drips and all that. Second place I'm going to show you is our workspace, which is where we will spend most of our day. This is our conference room. We do our chart rounding in here. You know, we do rounds with the attendings. Recently, we just moved to patient-centered rounding by the bedside. So most of what you do in here is just kind of information gathering, calling consults, but the formal rounds are the bedside with the patient, which is great because it gives families time to ask questions, you know, in regards to patient plan of care. So then that way there is not a whole lot of information that's just left out. And right next door to our team space, which is our conference room where we usually work, is the office that usually the hospitalists will spend a lot of time in. So if you're looking for any one of them, and if they're not in here, usually you can get them on Dock Halo. They're probably downstairs in their offices. But this is where they typically spend most of their morning when we're rounding and doing all that good stuff. So we're gonna walk over to the PEDS side. I think the pediatrics floor has, I think, a total of 36 rooms. And from room 28 to 36 is what is typically considered as PICU. I mean, those rooms could also be used for PED status, but those are the rooms that we typically reserve for PICU. And here is the most amazing place in the world, is our atrium. We're not using it as often now because of COVID, but typically, without COVID, this is where the kids can come in and play, which is fantastic. I have spent time in that TP myself when I'm on nights, so don't judge me, but it is just a very peaceful place, and it is a great addition to the PEDS floor. I think it really helps out a lot of kids. And upstairs, if you can see over there, is our NICU, so they can see into the atrium as well. On the PICU side, typically starting from room 28, which is also empty. They're a little bit larger than a regular PEDS room, but that's just pretty much looks the same. So in terms of PICU, we don't round here with their attendings, but we do all the admissions, and so we do get a little bit exposure that way. Over on your right is where the attendings will typically be situated, and if you need anything, they're very much willing to help. So even if we don't typically round in PICU, we do get to do admissions, which is great because it does give us an insight of what, as family doctors, sometimes we can't not manage and we need to refer out. So it is a great exposure. And you know, we have a great experience here. This floor stays really busy because we do have a large community just with South Bend and surrounding areas, but we also get referrals from as far as close to Chicago, which is about 2 hours away. So we get, I think, from about 28 facilities is what I've read, is we get referrals from those facilities. So we're very busy, especially during winter. We're usually at capacity. Which is great for us because we do get a lot of exposure and training. That is the PEDS floor. Thank you for joining us on this virtual tour, and good luck with interviews.
Hi, I'm Betsy Sutherland. I'm one of the third years here at Memorial Hospital, and I'm also this year's chief resident. I get to show you some of my favorite parts of the hospital and probably the most fun parts of the tour. So here we are in our main entrance, which, we often go through the side entrances and all the secret passageways. So we have to give you a demonstration of how beautiful our main entrance is and sort of what the patients first see when they get here. So we're about to hit a crossroads up here. We have some demonstration of Beacon history on the wall, and if you were to go to the right, then we have where you can go to the peds floor. You can also get to obstetrics that way and the ER. If you go the other direction, that's our main hospital where we do our adult medicine. That is also where we're going to be heading next to see our doctor's lounge and our resident call room. This is the Council Oak Room. This is where we have rounds every morning. This is medicine rounds, and we do table rounds where we talk about each patient with the attendings and other residents, and we have the information up on the screen. And it's a good way for us all to be on the same page every day before we finish seeing patients. All right. This is our medicine team actively having rounds. Hello, everyone. Good morning. All right, we'll let you work. Carry on. In very close connection to our Council Oak Room is the cafeteria. It's very conveniently located for your quick pre-round breakfast and coffee pickup. So the cafeteria is one of the great perks of our program. We, as a part of being residents here, get to eat our food for free. And we have very supportive cafeteria workers who have never judged my food choices and are always glad to serve us. These are the stars of the cafeteria right here. Okay, we are about to enter the physician call room and office space. Our adult hospitalists and pediatric hospitalists also have offices along this hallway. Okay, here we have our very own family medicine residency suite. It is complete with a bathroom and kitchenette and 2 call rooms. We had told our attendings that we enjoyed working in this space together and that we really needed more individual workspaces. So we added some tables, chairs, and even some couch side desks there so that we could all work in here together and enjoy one another's company during the long hours. Here are our call rooms with beds and just an area to relax. This one is freshly used by me on my peds shift last night. Quite comfortable, by the way. And then this one is a second one, and I would like to draw your attention to our records board. It's a little bit messy. If you're OCD, it might bother you just a little bit, but the awesome thing about this is it goes back many years, and several of our attendings are still holding significant records on this board, and it's fun to look at their names and be able to compare yesterday to today, so to speak.
Hello, my name is Megan Boyk. I'm one of the third-year residents. I'm going to be showing you guys our new physician's lounge that was just renovated in this past year. So it's right over here. So here we have a group of computers with a printer that we can use if you just need to quickly print off your list early in the morning. And as we come around the corner here, there's also some desks with additional computers here. When I have my own groupers in the hospital, I'll often sit here to pre-round on them and do my chart reviews early in the morning before I go up and see them. We also have some additional areas to sit over here. We have a really nice fireplace, a TV, and a group table over here where we can sometimes sit and work together on some of our tasks for the day. We do have in here also some locker rooms and some restrooms, super nice. There's a locked safe box over in the corner, and some kind of areas to hang up bags and jackets, and some lockers as well. And then over here we have my favorite part of the doctor's lounge, which is the food. They do put out lunch for the doctors here daily for free. And then they also have some fruit and some toasters for the bagels and the donuts set out as well. There is coffee machines, and then we also have plenty of tea available, as well as some additional drinks in the fridge, milk, juice, etc. So this is what we've got in the doctor's lounge. One of the great things about our hospital is the residents are treated just like the attendings are, so we're more than welcome to use this lounge for anything that we would want to. And it's definitely a great spot to come and do a little bit of work or grab a snack.
I hope you enjoyed getting to see the spaces where we eat and gather and learn together as a group. I'm looking forward to meeting you all and hearing from you during this interview season. And we wish you just the best of luck and that your future careers are everything you dreamed.